So, you probably already know that Obamacare totally sucks. But many of you don't really know why. In fact, a lot of people that hate Obama and his healthcare policy don't even really seem to know what it is. So, I'll explain. Now, first, whether you're Republican, Democrat, Green Party, Libertarian, or an independent like me, everyone agrees that the healthcare system in America is completely America has the world's most powerful economy. We've got a massive modern infrastructure. We've got the best medical schools on earth, and yet the USA has one of the worst healthcare systems in the developed world. 50 million Americans are completely uninsured. Most of us are underinsured, but we're the richest nation on earth, and 1 out of every 6 Americans have no healthcare coverage at all, which is really bad for everybody. It's bad for the economy, it's bad for the general welfare. I mean, even if you're one of these individuals with gold-plated health insurance, having a bunch of people running around in your country sick, spreading disease, not coming to work, not paying their taxes, going to the emergency room, dropping dead, and we all have to pay for it. And then these individuals and their families, they have huge medical bills that they can't pay, so then they can't buy other goods and services in the marketplace, which is the engine of our economy. And they can't even pay their mortgages, many of them. In fact, that was the #1 reason for foreclosures during the housing collapse, which led to a global economic crisis, unforeseen medical expenses. So if you think, like a lot of extreme right-wingers and libertarians think, that I've got my own healthcare situation taken care of, so I don't need to worry about anyone else, that's pretty stupid, because it's super obvious that when a bunch of people in our society don't have healthcare insurance, it's really bad for all of us. And for the people who, like me, work really, really hard and we haven't been denied by insurance companies for things like pre-existing conditions, and we pay for our insurance, we're getting completely screwed by corporate insurance companies because they're colluding together, they're writing laws that benefit themselves and screw over consumers, and then they pay legislators to get them passed. I mean, these corporations have teams of lawyers and politicians. Many politicians actually work in the insurance industry. Look this up. Before and after public service, they go to work for these private insurance companies. There's virtually no choice amongst providers. I mean, all the things that we associate with competitive marketplace, right, with the so-called free markets, I mean, really absent from the American insurance marketplace. And corporations are charging obscene amounts to all of us individuals and then denying us coverage in many cases. There are literally people who work at American insurance corporations whose job description is to find ways to deny people coverage. They deny treatments, they deny medicines, they manipulate doctors and hospitals, tell them what they can and can't do. I mean, right-wingers are always complaining about, well, don't let government get between your doctor and you. Well, insurance companies, private insurance companies do exactly that. They deny people coverage and treatments and options, and they say this is experimental and you can't do that, and they have caps on care. Now that is the real death panel. It happens every day in America. And that's because the healthcare system in America is run by corporations. And if you went to law school like I did, or you studied business in college like I did, you will learn that corporations have a fiduciary duty to their shareholders to maximize profit. Basically, healthcare in America is about profit, not people. As a result, Americans pay more for their healthcare than any other people on the face of the earth. We spend about $8,600 per year per person on healthcare. That's about 17% of our entire gross domestic product. I mean, almost $1 in $5, and that's the direction we're heading, is spent on healthcare. Every other country in the world spends less than half that. In Canada, France, Germany, Japan, in the UK, a country that is very similar to us demographically and in terms of lifestyle, a country with a much weaker and smaller economy, they pay about $3,400 per person per year on healthcare. Less than half of what we spend. Now, this is for many reasons, but most importantly, it's because consumers have no real power against these huge corporations. When you have a heart attack, there's not much choice after that. An ambulance comes that you don't choose and takes you to a hospital and give you a doctor and they do procedures. All of that you don't have any real information about. Think of the elasticity of demand in that situation. Either you have the procedure or you die. The private healthcare industry is just going to charge you whatever they can get away with, and you have to pay it or you die. That's why private for-profit healthcare doesn't work, and every other developed country has realized that. Just look all over the world. Old, cheap, easy, quick procedures. They don't involve a lot of labor or research or materials. They're very, very, very cheap in every other developed country. But the cheating, greedy, profit-seeking corporations in America charge insane amounts. If you had an angiogram in Canada, for example, it's going to cost you about $35 cash. If you walk into a Canadian hospital and you're not a Canadian and you don't have insurance and you just need an angiogram, it's going to cost you about $40. In the USA, $2,400. If you pay cash for a C-section birth in Spain, it's about $3,000. In the USA, $15,000. Again, if you don't have any insurance, but you need an MRI, old antiquated technology, in the country of France, it's going to cost you about $350. In the USA, well over $1,000. And depending on just how corrupt your particular American marketplace is, you could be charged up to $3,000. It's a complete ripoff. And that's why every other developed nation in the world pays less in taxes for healthcare than we do. Those countries with universal healthcare, where everyone gets coverage and they don't have to pay any cash when they go to the hospital, they actually pay less than we do in taxes. So when people say, oh, if you have universal healthcare, taxes will be sky high, it's actually the opposite is true. They pay less in taxes than we do. See, we already pay for Medicaid, Medicare, healthcare benefits for the poor people and for old people that can't afford it. And we pay it for government workers and veterans, and we subsidize a lot of our healthcare industry. And we pay huge amounts of taxes for it because the prices are so obscenely high.
Now, you might think that because we pay so much more for our healthcare, that we're getting a higher quality of care. Wrong. The World Health Organization ranks America's healthcare system 37th in the world. Can you even name 36 other countries?
Life expectancy is 50th. I mean, there are only 34 industrialized, if you will, countries on Earth, and we're 50th amongst all nations in terms of life expectancy? And of the 17 high-income countries studied by the National Institutes of Health in 2013, the United States had the highest level of infant mortality. That's obscene. We have high heart and lung disease rates, high STD rates, adolescent pregnancies. We have very low disease survival rates. We undergo needless, expensive procedures. We're hospitalized when we shouldn't be sometimes. We're prescribed harmful pharmaceutical medications when we don't need them sometimes. We don't have well care. We don't have preventative medicine. And that's because we're customers, not patients. I mean, in the UK, doctors are paid based on performance. I mean, imagine that. If they have high cure rates for patients with cancer, they get more money. In America, doctors are paid based on how much they can charge you. So you can see our healthcare system was totally jacked. I mean, even Republicans who typically support corporate greed, they couldn't deny that our healthcare system was completely broken. An unhealthy workforce and consumer base, and a huge amount of people who can't pay their bills because they're totally bankrupt because of these obscene medical costs. It hurts the entire economy. It even hurts rich people. So conservatives came up with this idea a long time ago, the individual mandate, because it solves the problem of the free rider, right? People, they don't pay for healthcare, but then they get sick and they go to the emergency room, they get life-saving procedures, and then we all have to pay for it. That's one of the biggest problems, right? So the Heritage Foundation, a conservative think tank, came up with the basis of Obamacare, the individual mandate. And then the Republican golden boy, Mitt Romney, he actually implemented this in Massachusetts. And now Massachusetts has one of the best healthcare systems amongst all states in the Union. But when the Democrats during the Obama administration tried to fix our terribly broken healthcare system by using the very same methods that the conservatives devised, the individual mandate, the Republican Party turned on the idea suddenly and rejected it because they hate and reject everything that the Obama administration does.
Because they're more concerned with taking back power than taking care of the American people.
All of its best cost-saving aspects. I mean, they demagogued rationing as death panels, right? But that's what insurance companies do right now. That's what I already explained, right? And they do it much worse in a much harsher way than the government was going to.
And they strip down the public option. Why would they do this? It's just another option for consumers, right? It's more competition. Isn't that supposed to be a good thing?
Well, that's not what Republicans want. They say they want competition, but really they want less competition so they can control the marketplace and charge huge, huge prices. They added a bunch of confusing, expensive stipulations, and then they wouldn't help in the rollout. They fought against its implementation. And then the government hired a terrible private company to design the website, and they totally botched it, which the government's responsible for. I mean, they hired a terrible firm. Now, the website's just a really small aspect of the law and the exchanges, but still, there's no excuse for that.
So yes, Obamacare did a lot of very good things. It provided access to health insurance for 30 million Americans who never had access before. Insurers can no longer discriminate against people with pre-existing conditions, which is very, very good. We gave tax credits to small businesses so they can purchase health insurance for their employers. We gave assistance to businesses that provide health benefits to early retirees. We extended Medicaid for the poorest Americans so they can have coverage. We're no longer allowing insurance corporations to discriminate against women, which is very good. Young adults, millions of young Americans can stay on their parents' plan until they're 26. We're giving seniors discounts on brand name drugs, and we can now cover the sickest Americans. So yes, we did a lot of good with Obamacare, but it's still based on that terrible private corporation system, and they're screwing us. So if anyone ever tells you that Obamacare is socialism, they're a complete friggin' idiot. It's totally private.
And that is why Obamacare totally sucks. And single-payer insurance. Nationalized, not for-profit healthcare, which is all over the rest of the developed world, is much, much better.